Excellencies, Honorable Ministers, distinguished delegates, it is a privilege to welcome you to the 37th Commonwealth Health Ministers Meeting. For me personally, this moment carries double significance. This is not only my first time joining you as Commonwealth Secretary General, it is my first ministerial meeting since taking office. That it centers on health, the most essential of all human needs, feels both symbolic and important. Let me begin by thanking the Government of Lesotho for their leadership as chair of this year's meeting. And to each of you, thank you. Your presence is not a routine gesture. It is an act of commitment in a time when your responsibilities carry more weight than ever. You are leading through challenge after challenge, global, national, and deeply personal. And you do so with limited resources, rising expectations, and ever more complex demands. I see that. I respect it. And I want you to know that the Commonwealth is here to support you. We gather as 56 nations, vast in our diversity, but united in our shared values, our mutual interest, and our belief in health as a human right. The COVID-19 pandemic remains fresh in our collective memory. It exposed vulnerabilities in every part of our systems, but it also revealed extraordinary resilience, innovation, and human spirit. It taught us what we already knew but had not always acted upon, that health is not an altruistic issue. It is the foundation of everything, of economic growth, of social stability, of dignity, and of peace. This year's theme, Investing in Health, Sustainable Financing for an Equitable Commonwealth, could not be more timely or more critical. Because we know the truth. Every investment in health is an investment in people, in productivity, in prosperity, and in the kind of future we want to build. We have seen real progress. Many of you have led efforts to strengthen primary care, expand coverage, and modernize systems. Public health investment has grown across the Commonwealth, and lives have been saved as a result. But we also know that this progress is precarious. The latest WHO data captures the rising pressure on health spending, and we know that 12% of households now face catastrophic health costs, a number which reflects the human toll. Dreams deferred, futures compromised, dignity diminished. And while demand grows, fueled by aging populations, rising NCDs, climate impacts, and mental health pressures, fiscal space is shrinking. Development assistance is falling, budgets are tight, and systems are strained. So the question before us is clear. How do we overcome these challenges to go further and faster in building health systems that are sustainable, equitable, and resilient? Three priorities stand out. First, we must shift from short term fragmented approaches to long term system wide investment. That means strengthening governance, the health workforce, infrastructure, supply chains, data systems, and most crucially, primary health care. Primary health care must be the bedrock, integrated, inclusive, accessible, and strong enough to withstand future shocks. Second, we must find new ways to finance health. That includes blended finance, social impact bonds, and public private partnerships. But innovation must serve equity, not undermine it. That requires strong regulation, public leadership, and shared accountability. Third, we must change the narrative. Health spending is not a cost, it is an engine of growth. The return on investment is immense in education, in economic productivity, in stability, and in the well being of every community. These priorities align with the broader work of the Commonwealth. Together, we can drive progress on non communicable diseases and mental health, which are now the leading causes of death and disability across the Commonwealth. We must prepare to speak with a strong, united voice ahead of the 2025 UN High Level Meeting on NCDs. Healthy aging, ensuring that as life expectancy grows, so does the quality, dignity, and support available to older people. Climate and health, because the impacts are no longer theoretical. From vector-borne diseases to heat stress to disaster-related trauma, climate change is already reshaping our health landscapes. Resilience must be built into every plan and every budget. Digital health, which offers enormous potential if we close the digital divide. That means investing in infrastructure, in skills, and in ethical frameworks that protect rights and empower users. Above all, we must put equity at the heart of everything we do. Equity is not just about access, it's about justice. It's about dismantling the structural barriers, economic, geographic, social, that determine health outcomes. The Commonwealth has a proud history of action in health, from the global campaign against malaria to the Commonwealth Code of Practice for International Health Workers to our leadership on cancer and other NCDs. We've shown what collective will can achieve. But today's challenges require us to be bolder still. Our strength lies in our diversity. We are home to small island states, large economies, young populations, aging societies. What works for one of us can inspire all of us, and what we learn together can drive progress globally. So let us use this meeting not only to agree on policy but to commit to action. Action to build strong, shock resistant health systems. Action to secure sustainable financing that protects people, not just budgets. Action to embed climate resilience and social justice in health planning. Action to unlock innovation and expand digital access without leaving anyone behind. I'll be your partner in this work, as will the whole Commonwealth Secretariat. Our health section is here to serve you, to share knowledge, foster collaboration, and help translate your vision into impact. Honorable Ministers, the road to progress is never easy, but in this Commonwealth, none of us are alone. We are a family of nations, rich in wisdom, in solidarity, and in the will to act. Let us make this meeting count. Together, let us chart a course to sustainable investment, not just in health systems, but in human potential. Because the future of the Commonwealth depends not only on economic growth or political stability, it depends on the health and well being of our people. So let us rise to this moment, because with courage, collaboration, and commitment, we can and we will build a healthier, more equitable, and more resilient Commonwealth for generations to come. I thank you for your attention. Before we proceed, it is fitting that we take a moment to acknowledge the remarkable leadership of the outgoing 36th chair of the Commonwealth Health Ministers Meeting, the Government of Kiribati. Over the past year, Kiribati has exemplified the spirit of service and collaboration that defines our Commonwealth family. Through its close partnerships with the Secretariat, including active participation in the Commonwealth Advisory Committee on Health and the distinguished launch of the new Technical Working Group on Climate and Health, Kiribati has left a lasting mark on our shared health agenda. So, on behalf of the Commonwealth family, I extend our deepest appreciation to their commitment and stewardship. Honorable Ministers, It is now my honor to invite the Honorable Representative of Kiribati to offer brief remarks as he hands over the role of the chairmanship to Lesotho.
Honorable Ministers, distinguished delegates, I'm deeply honored to be with you all today and to take over the baton of Chair of Commonwealth Health Ministers Meeting. I would like to thank my colleague, the Honorable Minister of Health from Kiribati and his team for their excellent stewardship of CHEM in the last year, particularly for putting a spotlight on the issues facing small states and their health system. Before I begin my remarks, it is my privilege to share a special address from the Prime Minister of the Mountain Kingdom of Lesotho, His Excellency Honorable Ntsokwane Samuel Matekane.
Your Excellencies, Honorable Ministers, Honorable Shirley Ayogo, Secretary General of the Commonwealth, distinguished delegates. It is my distinct honor and privilege to join you today on this auspicious occasion of the 37th Commonwealth Health Ministers. We are indeed grateful as Lesotho to have been mandated to serve as the chair of this important meeting. The theme of this year's meeting, Investing in Health, Sustainable Financing for an Equitable Commonwealth, is both timely and essential. We are here not simply to exchange ideas, but to confront one of the greatest challenges of our time: how to build health systems that are strong, inclusive, and resilient. Health must no longer be seen as a cost to be contained. It must be recognized as a foundation for human dignity, economic development, and our collective resilience. Across the Commonwealth, many of our citizens still face catastrophic health expenses. Too many systems remain fragile, and many communities remain underserved. This must change. As we look ahead to an uncertain global landscape marked by economic pressures, climate impact, and shifting demographics, we must reimagine our approach to financing health. And in this context, the Commonwealth has an enduring and important place. It is a community built on solidarity, mutual respect, and practical cooperation. Amidst the shifting geopolitics and competing global priorities, the Commonwealth remains a steady voice for equity, inclusion, and shared responsibility. We must not underestimate the power of this collective voice. The Commonwealth, with its remarkable diversity and shared values, offers a unique platform to learn from one another, act in solidarity, and drive progress that leaves no one behind. Lesotho is committed to this mission. We continue to strengthen our national health systems, expand access, and explore innovative financing approaches suited to our context. But we also know that no country can do this alone. Partnership across the borders and sectors is the only way forward. Let us therefore use this meeting not only to reflect, but to commit, not only to discuss, but to act. Let our deliberations produce outcomes that will make a real difference for the people we are here to serve. I thank you for your attention and wish you productive and successful deliberations. Thank you.
I would like to thank His Excellency, the Right Honorable, the Prime Minister of the Mountain Kingdom of Lesotho, for these important remarks and his leadership on strengthening our health system in Lesotho and championing health and well-being of our citizens. We meet today to discuss a matter of paramount importance: sustainable financing for equitable health systems across the Commonwealth. Our countries face a range of competing challenges: the health and the socio-economic impacts of communicable and non-communicable diseases, climate-related health threats, increasing incidence of mental health conditions, aging demographics, and multimorbidity, all of which presents challenges to the health, well-being, and prosperity of every Commonwealth country. For many low-income and low-middle-income countries, these challenges are often magnified by limited resources and increasing financial strain. The rising catastrophic health expenditures underscore the financial burden on households, which the proportion of the global population spending more than 10% of the household budget on out-of-pocket health spending increased from 9.6% in 2000 to 15.6% in 2015 and 13.5% in 2019. Distinguished delegates, as ministers of health, as ministers of health, we are entrusted with the well-being of our nations. We must prioritize sustainable financing to strengthen our health systems and promote equity in access to health services, working closely with our counterparts in the ministries of finance. We need innovative financing models and renewed approaches to enhance physical space for sustainable, strong, and resilient health systems. It was very intentional for us to name the theme of this meeting as investing in health, sustainable financing for an equitable Commonwealth. Investing in health through sustainable financing is essential for building resilient health systems and achieving long-term socio-economic growth. As we gather here today, let us reaffirm our commitment to action. The focus of this meeting must not be on mere rhetoric, but on concrete steps and tangible outcomes. We must move beyond talking and into action, translating our discussions into policies, investments, and initiatives that strengthen financial sustainability of our health systems and improve the health and the well-being of our populations. Let us seize this moment to chart a bold and visionary path forward for the Commonwealth, one that places sustainable financing at the center of our health agenda, empowers individuals and communities to take charge of their health, leaves no one behind, and extends a special hand of solidarity to our most vulnerable member states, including small states. Together, Let us transform our words into action and build a healthier, more equitable world for generations to come. Thank you all for coming together today, and in advance for your openness, cooperation, and commitment to building a more equitable Commonwealth. I look forward to these discussions on what steps we can take together. Thank you.